Not sure who to call for expert advice? Let's talk MAP consultants. Okay, before we get right into it, my name is Nurse Stephanie Victoria. I won't bore you. I've been a nursing faculty forever, since 2013. I have my own school in Massachusetts, and I served as a director of health services. So let's get right to it. Of course, I'm reading from the Responsibilities in Action in Massachusetts for our medication administration program, but a lot of it you could check your state to see if there's some subtle differences. So let's go through what exactly a MAP consultant is, okay? I'm here to help you pass your MAP exam or your medication aid training exam. So a MAP consultant, essentially what I tell my students, think of it this way. You go and you get a certificate and you're able to administer meds. No matter what the length of the course is it equivalent to becoming a doctor? I hope you know that the answer is no. Is it equivalent to becoming a nurse? The answer is no. Is it equivalent to becoming a pharmacist? So there has to be some knowledge that you are missing, right? That's fair. So when there is a question that medical knowledge needs to answer, that is where you insert the MAP consultant. So let me give you a scenario. This is going to be two videos. I have this video to explain to you what a MAP consultant is, and I have another one to talk about who you call at different times, okay? So in the state of Massachusetts, for example, in a group home, when you pass and you become a certified MAP staff, oh, sorry about that. When you pass and you become a certified MAP staff, you are allowed to administer medications. Now, we will go over that in thorough detail. Now, for example, let's say a patient is nauseous, correct? You gave them meds and for some reason they're nauseous. You cannot delve into your years as a nurse to see what to do because that would be called assessment, okay? That is operating outside of your practice. And the actual term is called scope of practice, which means what you are allowed to do within your job or certificate. You cannot prescribe other medications, right? So you need someone to insert with clinical judgment and advise you. So you would there call your MAP consultant, okay? So MAP consultants here, it's very important that you know who is able to serve as a MAP consultant. Okay, let's not worry about the neatness. Okay, let's more so just focus on it here. Who is able to serve as a MAP consultant? Now, again, in Massachusetts, a nurse, an RN. Now, you have to look at the ending. For example, I sign my name, Stephanie Victoria, MSN, because I have my master's, comma, RN. That means registered nurse. I am not a prescriber because I'm not a nurse practitioner. I'll do a different video on that, but I'm a registered nurse. Therefore, I can serve as a MAP consultant. Now, here you would ask yourself, can an LPN, a licensed practical nurse, serve as a MAP consultant? And the answer is no. Now, I love my LPNs. My mom is an LPN, but they cannot serve as a MAP consultant. So you have to look at these letters very carefully as you work as a MAP staff to understand who you're dealing with. A registered pharmacist, so it's RPH, can serve as a MAP consultant, and that's not pharmacy tech. That's not the person who gives you your meds behind the CVS counter. We're talking about a registered pharmacist. And then a healthcare provider, meaning someone who prescribes. Now, this one, the HCP gets a little crazy. Let me raise the LPN here because I don't want to confuse you. The HCP gets a little crazy because there are several credentials that could serve as a HCP, a healthcare provider, meaning they can prescribe medication. And so now, again, I'm focusing on Massachusetts. A lot of this can count to several other states, but I just want to be clear. So when we do HCP, of course, the MD, which is a medical doctor, can serve as a health provider. Okay. A nurse practitioner, a NP. So remember, I said I have my master's, but it is not in nurse practitioner school. Okay. So an NP can serve. Let me just see, did this stop? An NP can serve. And then also a PA in the state of Massachusetts, a physician's assistant is able to prescribe. So a P can prescribe, physician assistant. You have several others. You have like a dentist, I believe is DMD. So these are the biggest three. So when I say healthcare provider, I just want you to think and look at how the person signed their signature to see if they are indeed able to prescribe. Okay, so that those are the people that could serve as a MAP consultant. And what a MAP consultant does is that they are able to fill in the clinical judgment component. So there are going to be times when you call 911 because it is an emergency, airway, breathing, circulation, or they fell and hit their head. There's a time when you call a MAP consultant because there was a medication error or you need clinical judgment. Or there's times you call the supervisor who's a MAP staff because you're out of certain pills and just the functioning of the group home needs some sorting out. Okay, so I hope this video helps you. All right, don't forget to like and subscribe and also click the link because I have practice questions to help you pass your medication aid state exam. And always don't forget to be essential.